So we've got some incredible topics to discuss today, all through the lens of health. And the first one that we're going to be touching on is around the multiple mass shootings that took place over this weekend. Then we're going to be talking about trans rights, children, and what's going on with health records and privacy, especially here in Pennsylvania. But this is an issue happening around the nation. And we're going to end by talking about what everybody was discussing last week, and I was dying to get your take on it. The connection, quote unquote, that the Trump administration was trying to make between autism and Tylenol, which has since been, of course, debunked. But I want to discuss what this does to the collective psyche once this level of misinformation is out and you have doctors trying to pull people back into evidence-based reality, and why this just continues to build mistrust. So if you're joining us, please feel free to leave any thoughts or comments for myself or Dr. Gentili below, and I will be sure to get to them. But I wanted to discuss first two horrific mass shootings that took place over the weekend. This is from ABC News. A gunman drove his truck into a Michigan church where hundreds were worshiping on Sunday morning, shooting congregants at a Mormon church before setting the building on fire. At least 4 people have been killed and 8 others injured. The gunman was then killed in a shootout with police. The FBI is leading the investigation, calling the attack an act of targeted violence. This mass shooting just comes amid a rash of violence against churches and other religious institutions, and amid a series of politically motivated shootings. And it also comes after a mass shooting at a waterfront bar in North Carolina that left 3 people killed late Saturday night. What's concerning to me about these shootings, once again, of course, is that they seem to be not just politically targeted, but these 2 particular shootings involved veterans. And so for me, the issue of our health and wellness focuses not just around mental health and access to guns, but also what are we doing or not doing to support veterans and their mental health and issues they may be dealing with, like PTSD, as we're being bombarded with an incredible rash of violent rhetoric that is coming out of our social media, which I think if you're already edgy, it could only inflame you from a mental health perspective. But first, before we dive into all of the nuances, Dr. Gentili, what did you think waking up Sunday morning and hearing that yet again, our country was exploding into gun violence?
I think the first concern I have is just the desensitization to all of this, because I mean, how frequently now, week to week, are we waking up to this type of news? And I think when we start to have that desensitization and it becomes just just another day, we feel this shock and awe, and then we move on, and we can't be moving on. We need to understand and start to dive into what is leading to these things happening. And I think, as you mentioned, there's so much anger out there, right? There's so much angry rhetoric. We are just on the spot looking for the next, headline that's going to inflame us, right? Or make us click. And that is really concerning, because I think when you have mental health concerns that aren't being addressed, that type of thing is just going to fuel that fire, and somebody's going to, break. Somebody's going to break. So when I see that, it makes me sad. It makes me really sad.
It makes me sad. It also makes me just really enraged, because so much of this is preventable. Our country is very unique in how we approach guns and gun culture. And there really is this fetishization of guns. I mean, I see on social media, there'll be these posts where people will put collages of all the guns they own and all the firearms they own. And it's almost become this warped sense of what it means to be an American. I think it's so entrenched in our culture. I remember even when Kamala Harris, the former vice president, was running for office, and somebody asked her about gun rights, and she said, well, I own a gun. I mean, it's so ubiquitous that it's not even a political party or an affiliation. It's just being American. And I think that, like you said, that desensitization and this idea that this is something we have to accept in order to have this quote unquote right is very frustrating to me, because I look at it as this is a public health issue. The fact that we can't seem to go to a restaurant, a concert, a place of worship, a school without this impending fear and this inevitability that this could happen again in our communities. to me, that's got to make us take pause of how that's working on the collective psyche. And I wanted to read you some statistics, Dr. Gentili, because I think we are just completely out of control. So this is from the Violence Project, and they said that the United States accounts for around a third of the world's mass shooters, despite just representing 5% of the global population. Now, with 73% of all mass shootings in developed countries occurring in the United States, this is a discrepancy that reflects deeper systemic issues like our nation's high civilian gun ownership, cultural factors like individualism and fame seeking, sensationalized media coverage, and of course, gaps in mental health and law enforcement. But I think it goes even a little bit deeper than that. I think once again, we are looking at a situation where people feel so disconnected from one another, so disconnected from healthcare supports, and so emboldened by this idea that anyone can and should, almost this level of entitlement that you should be allowed to own a gun, that we've created sort of this perfect recipe for one mass shooting after another. And I was sharing my frustrations around the fact that our elected officials across the board just do not seem to act on this because of the amount of money that is being fed to them through different lobbying groups like the NRA. But of course, there are things that we still could do to help alleviate some of this energy, including more healthcare supports in general. But when you think of those statistics and how incredibly out of bounds the United States is, what goes through your head as a physician and as a parent?
Well, as a parent, complete and utter fear. I'm going to be honest. So, like, just to speak very frankly, every single day when I drop my kids off at school, I'm scared and like just basically wait until like the moment I can pick them up. I think, I think of these people that are shot in churches. Like, I go to church. Like,
Right.
this is literally anywhere.
Mm-hmm.
Anywhere
Mm-hmm.
is at risk. So as a parent, completely terrified. As a physician, heartbroken, also terrified. Not shocked though, for
Yeah.
all of those reasons you listed. None of this is surprising to me. It's, in fact, this perfect storm has been building for so long that it should not surprise us, but it does not mean that we should just let it be then, right? Like
Yeah.
this is a cry for help, for major reform needed across the board.
Yeah.
From a health and public health specifically perspective, of course, it's the access issue in the first place to healthcare that I think is a major problem. And there's also so much of people just not feeling heard in healthcare settings. The long wait times, the lack of access in the first place, and then when you finally get there, feeling like you're not a human being, and the dehumanization that happens on a day-to-day basis in the healthcare interactions, and then the lack of mental health support on a very affordable, sustainable basis.
I couldn't agree more. I also think it's important to acknowledge that so many of these shooters sort of fit a similar profile of being a white male. And I think that's an important component, not because we're trying to create a situation where we're othering people or pushing one demographic out in front for an arbitrary reason. But the truth of it is, this country very much exists in a patriarchal, white supremacist framework. And it is often, I think, not talked about enough how those systems of injustice impact our public health sphere. And the reality is, too, I was a mental health professional before I became a journalist, and I worked with many different demographics. And there is this thing that happens in particular with young men and this idea of isolation. Socializing is different for boys than it is for girls in the way that we raise our children. And I think this lack of integration and creating this sense of superiority and fear around the other sets up this perfect framework for entitlement and also this irrational sense of I'm being persecuted as this white male majority. Instead of calling in to the reality that they need to be a part of the society, they're almost pushing themselves out. And now, with all of this stuff happening online, this siloing and this information that they can grab onto that makes them feel, oh, this isn't your fault. This is that person, that woman, that person. So there is now this antagonism. And now you've added in unfettered access to firearms.
Yeah.
And I think we really need to start thinking about how we take care of our boys and our young boys in particular. Do you have any advice to parents who are raising boys, how to create a different framework for them to engage with so they feel connected to community? Because I think that's a part of this too.
Yeah. I mean, as a person who's raising a boy, I think about this all the time. You know, we do a lot of work around naming feelings. We do a lot of work around being able to actually verbalize and talk through our emotions and concerns and fears, as opposed to the natural tendency toward lashing out. Maybe that's physically or verbally. You know, and I notice the differences in raising my two kids, that one's a boy, one's a girl, right? Like I notice the difference in how they're treated at school. I notice the difference in how they're treated in sports, since I do see them in sports in both of those settings. And I think there's a lot more rhetoric when we're raising boys of suck it up. There's a lot more rhetoric of fight it out instead of talk it out. And then there's these expectations, I think, that are put on boys in our society of you're the next generation to change the world, right? But like there's not so much that conversation with young girls. And so there's this strange pressure that then comes from that, that I think is also quite unusual. Or unsettling, I should say, not unusual, unsettling. So yeah, I see it all the time. And so I'd say that talking about feelings, talking about naming feelings and moving less toward violence, and more toward, like you said, community is a key step that needs to start at a very young age.
I totally agree. I actually watched this really interesting video of this mother, and she has two very like elementary school age boys, and she was watching Charlie Kirk videos with them to help them identify what is the rhetoric being said and who does this rhetoric support and who does it harm. And so she talked through these conversations with her sons, and it was fascinating because instead of it being one of those things that where they isolate and watch these kinds of, videos on their own, she called them into a conversation. And because the one son was a little older, he was talking a little bit more advanced, a little bit more nuanced. And you could really see the younger son listening to his brother and then communicating his feelings around, well, I don't think that's nice that he's saying this about Black people. My friends, I have Black friends, or I have a girlfriend, and I like her. She's funny and smart. I don't think she's beneath me. And I think I've never seen anybody doing that on social. And I thought, wow, this is very smart because once again, to your point, it's about calling in, meeting kids where they are, and honestly catching them before they become indoctrinated, which at that point, it is much harder to undo some of this messaging. And obviously, we don't know what the motivation necessarily was for either of these mass shooters over the weekend. But my guess is there's probably a sense of isolation and deep-seated resentment towards groups of people if you are targeting, in particular, a place of worship. So that's something else I think that we could all stand to think about a little more, is how do we engage our young men and boys in conversation around gender identity, race, and of course, white supremacy and patriarchy. And speaking of these very nuanced conversations, there was a very interesting article from Public Source, which is a Pittsburgh-based publication, but well worth reading for all of my friends that are watching this that do not live in the city. And this article, I really wanted your thoughts on, Dr. Gentili, because you speak truth to power a lot about the healthcare systems, the big box systems in particular. And UPMC is one of the biggest systems here in the state of Pennsylvania. And they really have a bit of a monopoly on our healthcare system, especially in Western PA. But this article focused on parents saying to UPMC, tell us whether you're giving our trans kids records to the feds. And this really gave me pause. The Department of Justice subpoenaed records of transgender medical procedures provided to minors. While some hospital systems are fighting the records request, UPMC has been mum. A group of Pittsburgh parents is urging UPMC Children's Hospital to protect their children's privacy following a Department of Justice subpoena that they said threatens to expose the young people's medical records. Pittsburgh Parents for Medical and Privacy Rights, a group of around 70 local families whose children's medical records could be at risk, said Tuesday that UPMC failed to communicate with them about the subpoena. They felt left in the dark and worried how private medical information could be used against transgender kids and their families. Wow. As a physician, what were your initial reactions to this from just an ethics perspective?
I mean, I just got the chills. I
Yeah,
think, and it's hard for me to separate out the physician from parent hat here,
sure.
but all of it from the privacy perspective, from the wow. I mean, these conversations, children having these conversations with health professionals is already such a vulnerable position to be in. And then to jeopardize that by the potential vulnerability of their conversations being spread to others, right?
Hmm.
That is a huge ethical concern. Huge ethical concern. And I am very curious what the physicians think about this that have cared for these patients. And did they
Yeah.
have a say in this? Like these are protected conversations and protected
Mhm.
medical records that are sounding potentially not so protected anymore. And was this disclosed from the
Right.
get-go? So I mean, it's very scary to me.
What also concerns me about this whole thing is we're really overblowing the community itself. The trans community is so small
Yeah.
in terms of percentage of people, and trans children that are experiencing, gender identity crisis, right? Where they're having feelings or they're having doubts about how they show up in the world and wanting to live in their authentic self. We're talking a percentage of a percentage of a percent. This is such a small amount of people. And so what upsets me about this whole thing is how quickly, once again, people feel the right to comment on other people's very private and personal business. This to me goes back to the abortion issue and the right to privacy and the right to make a decision that really just impacts your own body. It's not a public health issue in the sense that, like, this isn't something that ripples out and impacts us like gun violence or airborne disease.
Just gonna
This
say that. Yep.
Right? And so what I found fascinating about this was the fact that UPMC can't stand 10 toes down and say we stand with parents and their right to privacy. Does this concern you as we're looking forward and we're seeing where a lot of our federal government is headed in terms of what is worthy of privacy and what isn't? The nefariousness of what on earth could they even want these records for?
Yeah, of course it does. And this, again, not surprising because we've
Right.
already seen this move by UPMC, which was taking
Hmm.
away the trans health clinic for
Hmm.
children's.
Hmm.
And again, such a small portion of the population has people so worked up,
Mm.
which is fascinating when many people are being murdered on a
Right.
quite regular basis or very severely harmed on a regular basis by something that we could just focus our attention to, which would be gun reform. Um, so I think this is yet again, this is just a smokescreen, right? This
Hmm.
is something to get
Hmm.
you hyped up about, and where they're really hurting our kids and they're forcing our kids into thinking that they have gender, identity crisis. No, like
Hmm.
this is about providing access to care that's safe, that
Hmm.
is vetted with experts taking care of it, right? And taking care of these children in a very evidence based way, and
Hmm.
then just taking that away completely and then putting their privacy at risk. You want to talk about long-term mental health
Oof.
concerns.
Mm.
I mean, this is a serious issue. And I absolutely have concerns then about what's going to happen down the line. Even in our world as direct primary care docs that operate outside of the big box system, that
Hmm.
operate outside of the insurance system, at what point are medical records for my patients going to be at risk? I mean, if you can pick and choose,
That
if
part.
you can pick and choose what's private and protected health information, then anything goes at this point.
I
Just like
think.
anybody can be anything at this point. Anybody can be the HHS secretary. Anybody can lead the
Mm.
CDC. Like there is nothing is regulated at this point and vetted.
Yes. Yes. And I think that's such an important point to make because to me, this all goes back to the distrust of institutions. And this is a perfect example of why there is that distrust when you have a large institution that did have respect and did carry weight for many years, now saying, well, too bad your records aren't protected and we're not going to protect our patients and the systems that protect us. So now you have this disconnect. Once again, you're going to have people afraid to go to their PCP, afraid to
Uh-huh.
take their child to the pediatrician. What if their
Yeah.
child is just experimenting with their gender, doesn't identify as trans, perhaps is playing with being non binary? Now
Yeah.
you have and they have a cold or they have the flu or they need support or they broke their bone, but now they're afraid to go to the ER. They're afraid to go to their doctor. This to me just sets up such a, once again, I keep using the word unnecessary. All of this has been unnecessary and completely, fabricated and manufactured, like you said, by these people in power who are not qualified to be in these positions. And so it has now taken that cascade effect onto your family doctor and the things that now you have to handle and deal with. And for our final topic, I want to handle the conversation around Tylenol and autism, because I know this in the fast-paced news cycle, this is already old, but I think it's incredibly important that we meet people where they are and talk about it. And for the people watching this on Substack, please stay tuned for this, because this conversation around autism and the Tylenol connection was so outlandish to me. And then I went on, Dr. Gentili, to Facebook. And I shouldn't have done that, right?
What layer of hell is that?
Why was I there? Yes, exactly. And I was seeing how people were like, well, see, I told you. Oh, that's so obvious. Yep, I've been saying this for years. Da, da, da. And I can't even imagine what it must be like to have to be you right now, and the questions that you have to field from your scared, nervous, frustrated, confused patient panel. What do you want people to understand about autism and about Tylenol during pregnancy? Because women are already unable to take a lot of things when they're pregnant. So please discuss.
Okay. All right. I'm going to take it down a few avenues here.
Yes.
Number one, when we are now continually putting more shame into women's lives, mothers' lives, that this autism concerns have brought up, right? This has become political rhetoric that is shaming women. That scares me. Okay. When we start to say, just suck it up and you don't have to treat the pain or your fever during pregnancy, this now continues to feed into this cycle of women's pain, women's issues do not matter. Okay. And that is a common thread we've seen for the past several months.
Yep.
That concerns me. When we have people giving medical advice, I'm not going to mention names, but like people giving medical advice on, during conferences, press conferences, when they can't even pronounce the word of the issue they're talking about, that concerns me, right? So people with no medical background giving medical advice to the American people, I don't think that bodes well. So I have concerns on a lot of fronts here, and I think it more and more has caused a state of just absolute chaos and confusion. And what I find fascinating is when I see the parents of children with autism, or our patients with autism living these beautiful lives, right? Like living these beautiful lives. And did they sit there and ask for someone to like shame and demonize what they're going through or put words in their mouths? No.
No, absolutely not. And to your point, we actually had some representatives here in Pennsylvania speak out who have autism, from Penn Capital Star, another great publication if you're looking for Pennsylvania specific news. And Representative Abigail Salisbury, who is a Democrat here in Pennsylvania and has been very vocal and open about being autistic, she said, it's not great when the president of the United States acts as if a condition that you have is a scourge or a plague on society. And those are the words I really wanted to just hone in on, because I've worked with a ton of kids on the spectrum over my years. And what really upset me more than anything was this idea that these kids and now adults would think that they are broken instead of just neurodivergent, right? There's a million variations of how we look at the world. Some people with autism and some children with autism are nonverbal. Some of them have a really hard time, and it can be extremely challenging for families, extremely frustrating to figure out, how do we communicate? How do we get them to be able to exist in a way where they can socialize and have a full life? I'm not discounting any of that, because once again, it is a spectrum, and some of these cases are very severe and some of them aren't. And the reality is the idea that any of those people could think now that they are unworthy of a place in society, or that they are somehow a thing to be fixed, because that's really the framework of this whole conversation, which really speaks to eugenics, in my opinion, of where we're heading here. was so alarming to me. So now we have two scapegoats really in front of this administration, the trans community and now people with autism. What concerns you when you look down the road and see where we're heading about what this could mean for people's access to care?
Oh,
And
certainly.
who deserves care?
Who deserves care, but also go back to the protected health information conversation we just had.
Yes.
So if this is something that's diagnosed when you're in clinic, right?
Mm-hmm.
And you are being evaluated with neuropsychiatric testing for, having being on the spectrum, you are coming in to access trans health care. At what point is this going to become public knowledge or in some type of database that is then going to affect your number one, access to healthcare? Number two, your finances. Number three, your safety.
Mm-hmm.
Right? I mean, like these are all things that are not out of the realm of possibility. And I think when people say, "Oh, you're getting all up in arms, you're really overblowing this," I hope so.
Thank you. I want to be completely overly dramatic.
I want to be wrong. Please,
thank you
please.
for once.
Yes. If it means the safety of children,
yes.
If it means that, please, I hope I'm wrong.
Mm-hmm. Mm-hmm. And I think the problem is this is the gaslighting that has happened for years now, for years. And in my opinion, it really started with when a lot of us were being like, hey, they're going to come for Roe, and that's going to be the beginning, not the end. And everyone said, oh, you're a hysterical woman. Well, here we are. I mean, they're talking about conversations now around getting rid of birth control and the abortion pill, et cetera, which we will save for another conversation because I want to dig into all of that. But I think the important part here is, everybody, all of these issues are interconnected, from gun violence to patient rights to the ways in which we shape conversation around public health. It is important to not only stay informed, but to really actively stay engaged with who are our representatives and people in public spaces that we need to hold accountable and remind them of who they are supposed to answer to, which is to us, the people that they represent. And in your case, Dr. Gentili, you answer to your patients. And when your patients are being fed this kind of confusing and harmful rhetoric, it only creates more challenges for you. And you are already faced with so many challenges. So what do you want people to understand from a perspective from a physician in this moment? Because I think there's not a lot of sympathy or understanding about what you guys are really dealing with.
No, I want to speak on behalf of my colleagues now. Because I am a very small subset of the population with the type of medical practice I have, where I have all the time in the world with patients, where they can text and call and email me. That, again, that's niche.
Yeah.
Most of my colleagues are 7 to 10-minute visits, right? They're churning through 20, 30, 40 patients a day. Do you think that there's time for these conversations to weed through the questions about the rapid misinformation that is just being spewed out there? No. We actually have to practice medicine and do what we were trained to do, which is help you with your acute and chronic illness, help you with mental health, help with preventative care. And now we've got this to weed through too. So put that into perspective. This is a very dangerous situation. And you think access was already bad. You think you already didn't have a good relationship with your doc because you didn't have much time. Now we have we have really plugged up the pipes here. And it's making it a lot more challenging.
Absolutely. And we're going to be discussing so many more of these issues, from the cuts to Medicaid to the threats happening to our access to health care in all of its forms, and hopefully some other issues surrounding diet culture and wellness grifters and all of the things that you can do to live a healthy life as well. There's a lot of positive things and developments that are happening in medicine. I would love the opportunity to be able to touch on those. If this news cycle would just chill out for a minute, I got a whole stack of things that I'm like, ooh, this is so interesting. And interesting has had to take a side seat to, or a back seat to terrifying, right? Yeah. But we're hoping to get through all of that and more. If you joined us today, please take a look at our names at the top here, Dr. Natalie Gentili and myself, Natalie Bensvenga, and subscribe to our Substacks. We're going to be trying to do this every other week because it's really important. Public health is in the eye right now of the storm, and I do not want these conversations to go unheard or unnoticed. So please share this work with everyone. And Dr. G, if people want to connect with you, you're very active on social. Where can they go?
You can find me on Instagram at Natalie Gentili MD. I also have started up a Substack here, so I appreciate your support.
Always.
And yeah, find us there.
Awesome. And you also are on YouTube.
I am on YouTube. Thank you.
Yes.
Yes, I have my own channel, Natalie Gentili MD, as well.
And I love your quick workouts and all of the things that you're sharing over there as well to help us with our physical and mental well-being. And until next time, everybody, please take care of yourselves and each other. Have a great rest of your day.